Shall we start?
Give me just 1 minute, sir.
Yeah. Once you say start, then I'll start the introduction. Okay.
Yes, sir. We are live now. You may now start the session, sir. Thank you, sir.
Yeah. Good afternoon, everyone. Welcome you all for this first series of webinar by National Board of Examinations on artificial intelligence in healthcare. And I thank NBE for giving me the opportunity to act as a moderator here. And it's my proud privilege and honor to introduce the first speaker of this series, which is starting today. And he is Dr. D. Nageshwar Reddy, Chairman and Chief of Gastroenterology, AAG Hospitals. To name a long list for his accomplishments, but in brief, he is a BC Roy awardee, BC Roy awardee in 1995, followed by Padam Shri in 2002, Padam Bhushan in 2016, and Padam Vibhushan, the latest in 2025. So he's also the member of National Academy of Medical Sciences Fellow, FAMS, and also holds the prestigious Rudolf Schindler Award from American Society of Gastroenterology and Endoscopy, and also a fellow of American Association of Advancement of Science and American Gastroenterology Association, as well as the ASGE, and also a WEO, that is World Endoscopy Organization Lifetime Achievement Award winner in 2022. And he's also the captain chair of 2024 by Johns Hopkins University. With these few words I invite Dr. Nageshwar Reddy to deliver his lecture. And a small announcement or a note is in the chat box. All the delegates who have attended don't have to write present, but that chat box is meant to pose your questions. And after the end of Dr. Reddy's talk, we will ask the questions what you have posed on that. And the moment you pose a question in the chat box, that means that you have attended that. So you don't have to put specifically present or yes in the chat box. Over to you, Dr. Reddy.
Thank you, Rakesh. I think first of all, I'd like to thank the NBE MS for giving me this opportunity to give this initial talk on a very important program, artificial intelligence in medicine and how we're going to use this. So as this initial talk, what I'm going to do is I'm going to actually give you a very brief overview. I won't go into the specifics and only give you a brief overview of what is happening in this area, so that the further lectures that are going to come over the next few weeks and months are going to give you a more specific insight into each area. I'd like to now start by sharing my slides, and I hope you can see this. It's titled AI for Medical Profession, the Need for Change in the Future Ahead. And you can see that we require really a need for future, what we should do. I'd like to start with a disclaimer that I'm not an AI expert. I don't possess the coding knowledge specific to underlying mechanisms of AI models. I just have discussions with our AI engineers and have come to know certain amount of AI. I can, of course, use models like ChatGPT, which becomes very important now. And therefore, with this, I'll start with how AI can be used in the medical profession. First important thing is, in fact, when I had to give this talk, when Dr. Mallikarjun told me I had to give this talk, I went into ChatGPT and put this in. I said, I have to give a 30-minute presentation on AI in healthcare. Can you help me? And you can see how easily it's coming out. Just in a few seconds' time, it's giving me what is the title, what are the points to do, what are the basics, and of course, and the conclusion of what I should do. So you see, this is the initial aspect of how, in fact, all doctors, I'm sure, are using already ChatGPT for various reasons in medicine. So this is the easy start with. But I think let's delve a little into the future. But before I actually go into how AI is being used, I want to tell you very clearly that medicine is still patient care with clinical examination, investigations, interpretation, treatment planning, and so on. Medicine can be never replaced by any other artificial techniques. And I think it's very important that medicine, a combination of clinical care and empathy, uses natural intelligence. But because of the what is happening in terms of artificial intelligence, we have to know how this can be used intelligently in our medical approach. So what I'm going to do over the next few minutes is to talk like both a clinician and an administrator to show you how AI can be used very beneficially for all of us in the field of medicine. To give you a short history, it was actually during the Second World War, Alan Turing, a British computer scientist who deciphered the messages between the German ships using artificial intelligence, who is often called the father of artificial intelligence. He was actually cracked the code between the various messages the Germans were using, and that's how the Second World War was won by the British. In the year 1956, the term artificial intelligence was introduced by John McCarthy. And at that point of time, and even now, we're not sure what it exactly means. It was then thought that artificial intelligence is an intelligence of a machine which equals to human intelligence. Even now, broadly, that's what we're thinking. Over the next 20 or 30 years, there's a winter of artificial intelligence. Nobody taught about it, nobody talked about it. But in 1980, machine learning came. And machine learning was that we could actually feed several data to the machine and get an answer from this. From these basics of machine learning in 2010, deep learning came. Now, deep learning was much more meaningful for medicine, and that's how we're progressing further. Now, what do you mean by deep learning? By deep learning, we actually put in several inputs into the machine. It synthesizes all these inputs and comes out with an output answer. This is deep learning. So it was really this deep learning which revolutionized everything that's happening in artificial intelligence. And this is a term we should be used to. There are a variety of deep learning methods like CNN and so on. But if you know about this briefly, it's okay. So 50s and 60s, you can see it was just artificial intelligence. Nothing much was done. Machine learning came in early 2000. And in 2010, it's a deep learning. But before we proceed further, for all the doctors, you just have to know three small simple facts. First, all this artificial intelligence algorithms written on three foundation models. These are called foundation models because these are the basic models on which AI is built on. The first foundation model is the language model, large language models. A typical example is ChatGPT. So all the knowledge available in the net is gathered together, synthesized, and you get an answer. This is typically what ChatGPT does. The second model is a computer vision model. Now, computer vision model is that you can actually show a picture, show something, and the AI will tell you that this is cancer, this is benign, and so on. This is a typical computer vision model. The third model is so-called NPL, or natural language processing, NLP, which is actually when you're talking, your talk is converted to text in a segmented fashion. Earlier, it was converted to text, but not in a segmented fashion. Now, with NLP, it's converted into an actual segmented text. So these are the three models you must know about. All these models can be used simultaneously. So we have what is called a multimodal models. So multimodal models are what we use commonly in our day-to-day practice. One of the things that happened initially, especially in many areas of medicine, was we started using computer vision first, saying that you can recognize the lesion and so on. This used what is called a CNN, a convoluted neural network. This is also a type of a model. Unfortunately, this became overused. It hallucinated, gave wrong impression. Therefore, for a large extent, the doctors were confused and so on. But I think now we want to simplify it and tell you how AI can be used in medicine in general. If you use AI used in broadly, can be used in diagnostics, imaging analysis, drug discovery, personalized medicine, predictive analysis, robotics, and so on. And let me just give you an example as we go along. The most often used AI is in radiology. We'll come to that a little later, imaging and so on. Of course, telehealth is another very important area of AI. So for the clinician, AI results in rapid and accurate image interpretation and diagnosis. For the health system, it improves efficiency. For the patient, it promotes personal health by processing the data of the patient. So these are broadly the areas where AI is being used. So one of the important things, and this has been repeated also in our inauguration ceremony, that doctors, especially when we started AI in a hospital, we have a large AI department, they were worried whether AI would replace them. I always tell our doctors that AI will not replace you, but a doctor who knows AI will replace a doctor who does not know AI. This is very important. That's the reason why we have, I think, the NBEMS conducting this program. And I'm glad that such a large number of doctors have logged. All of us have to be AI familiar in future because it's going to be an important part of our practice. So let's look at broadly what AI can do. Again, I'm not going to very specific areas, broadly, and also tell you clear examples of how we have used AI in our hospital. It's for health services management, for predictive medicine, for patient data and diagnostics, and clinical decision making. So let me go through some of these individual. For example, can you use artificial intelligence to improve the health services in your hospital? So here, for example, we use AI to optimize operational efficiency, predictive analysis, supply chain optimization, and of and complex. There are very, very clear examples of how this can be done, but I'll show you a very small example of how we at AAG have been using AI for our benefit of this. We have actually created Mira, which is a robotic system, which Mira is a medical information robotic assistant, which helps us in several ways. And let me...
Hello, everyone. I am Mira, the medical information robot at AIG Hospitals. I am your future healthcare companion and here to change the way we think about healthcare. I have been meticulously designed to assist doctors, empower nurses, and most importantly, ensure that patients receive information in a faster and better way. I will assist patients and healthcare professionals, but never replace them. My goal is to enhance patient experience with human oversight, and in the future, with appropriate training, my role may increase for evidence-based circumstantial requirements. I look forward to learning from the clinicians' experiences to continuously enhance my skills in the field of gastroenterology and other specialties.
So you can see we can use a medical robotic information assistant like that very easily. All of us can have this out at the outpatient situation, where instead of answering all sorts of questions from the patients, Mira will be fed with all the data, so patient can say, okay, doctor has told me this, what are the complications of this procedure before I undergo this, how should I take these tablets? All these are answered by the information is given by this system, so that you don't have to waste your time doing all this. So you can spend more productive time with the patient. This also can help us in postgraduate education, where Mira can be taught, say, how a procedure can be done, what are the indications, contraindications, all this can be done. So this is a very useful way, and already we're starting to see this being used in many outlets where, in fact, in IT systems now, they have Mira in the offices. So instead of having an office person helping you out, Mira does all this. The second area where in health services management we used AI is in this, and this is called iSafe system. Now, what we found is that patients admitted in the hospital can have complications, and these in-hospital complications can result in sudden cardiac arrest. So you have so-called code blue in hospital. Code blue is being called each time, and then the whole code blue team rushes to the patient, tries to revive. For example, if we have 6 code blues in a hospital, we can save only 4 of the patients. 2 of them succumb in spite of being in the hospital. So what we did is we put in certain parameters, 6 parameters, which are normally monitored in the hospital: pulse rate, temperature, oxygen saturation, and so on. And these are fed into an AI system, an algorithm, which when the patient reaches, say, 4 or so, will immediately warn the medical emergency team. And before the patient crashes, the team is warned, and immediately the code blue team goes there and revives the patient. This now in a hospital has been so efficiently used that not only have the code blue calls come down, but deaths due to a code blue call has almost become 0. So this is something that we can. Similarly, sepsis, we can predict sepsis before it occurs, and these are also available algorithms commercially also. Before a patient crashes, goes into sepsis and shock, we can predict and treat these patients based upon AI. Again, another area where in health efficiency we have used AI is an example that if a patient goes for surgery in a hospital, or most hospitals, he has to go for a pre-anesthetic checkup. And you can see from a spaghetti graph we got by using AI that each patient has to reach 17 areas before he's finally confirmed to say that you're fit for surgery. When the patient does this, he actually becomes tired and doesn't want to come for surgery. And the dropout rate is to be around 20 to 30%. So we used AI to predict whether this can be changed, and AI gave us an option that we could have a separate tower where all the patients come for a checkup to a single area. Everything done is 2-3 hours. And when we actually worked out the economics using AI, using this pre-surgery lounge, we found that not only are patients very comfortable, but the dropout rate from 20% became almost less than 1%. Another use of how administrators can use AI. And of course, we have a large endoscopy unit, and now we have started using AI to track where the patients are in this 20 rooms. This can be used in all the OTs also. The patient gets an RF and the RF tag, and then AI will tell us exactly which part of the area a patient is, which theater is being used, which theater is vacant, what is the waiting time, so that our complete TAT time can be decreased to short periods. Again, very useful as an administrator. Now let's come to the second aspect, how it can help with preventive medicine. So predictive and preventive medicine is becoming very important. Early disease detection, risk satisfaction, personalized treatment plans, and so on. In fact, it's now believed that AI can actually predict outbreaks. If we had the same AI system in the pre-COVID era, COVID epidemic could have been predicted. They would have a very sophisticated system which tells us an epidemic is there, cut off all the flights from that area, see nobody enters that area. All this can be predicted very earlier on. And unfortunately, we didn't have it at that time in COVID, but now that we have this, I think this can be very effectively used to COVID prevention. Also, drug use and predicting which patients are going to respond to drug. This is again a program we started in the hospital. All patients using more than 4 drugs are being given, put into an AI system which tells us how these drugs are interacting among their cells, how each patient, how the genetic workup actually changes the drug usage. And when we started using this, 40% of the patient's prescription changed, optimizing the drug use in these patients. And similarly, AI can be extremely useful in this. For example, in patients with fibrosis, we start using AI, liver fibrosis, to see what is the exact fat and fibrosis in the liver. It's extremely useful to predict what type of therapy can be given. We use fibroscans for this, which are very costly. The cost of the testing also is very high. And we now developed, based on just 4 simple blood parameters, AI can actually predict in this particular patient what is going to be the exact steatosis and what's going to be the exact fibrosis, just on these 4 parameters. So costing about 400 rupees. No need for a fibroscan throughout anywhere in the country, and therefore this is an extremely important example of how AI can replace costly diagnostic tests. Of course, I think these are the 3 main areas everybody is looking at. Drug discovery. In fact, drugs now can be discovered very fast. It used to take about 20 years on average to make a new drug, but now using AI, it's coming to about 4 years or less. That's very important. Genomics is a very complex science, and AI is being extremely important using this for bioinformatics and so on. And finally, microbiome becoming important for us in all of what we do in health. And microbiome and AI is another area where AI is being used extensively to sort out all microbiome-associated diseases. So from there, we come to patient data and diagnostics. AI telemedicine is another area where we're going to use AI. Natural language processing, I'll show you an example for taking clinical notes, are another very important area. So what we normally do as a patient, when he comes to us, we as doctors talk to him, find out what he has got, make a prescription. This usually takes about 20 minutes. But unfortunately, in modern medicine, because of the need for having health records, when we try and do this, most of the time, out of this 20 minutes, 15 minutes, we are spending our time looking at computers, trying to feed in all the data, and we're not looking at the patient with eye contact, which is very important for diagnosis and therapy. Now, we actually made a system called the PRISM, the Prescription Recorder Intelligent Summary System. And what it does is you all the time talk, you're watching the patient, discussing with the patient, and what all you do in terms of talking and discussion is actually coming in a printed, segmented form using NPL. And this will actually, this algorithm now gives us freedom to just keep on talking. And only finally, after we finish the whole consultation, you get a printout in a segmented form, the past history, present history, allergies, and so on. I think this is something which we found extremely useful. We have validated this in about 100,000 patients, and I believe that this form of AI is going to replace our standard way we actually do EHRs. So this is also that we can continuously monitor the patient's real time, and of course for diagnostic extremely useful. And this is an example. In fact, this is a very recent paper in Lancet Oncology showing that how artificial intelligence in pancreatic cancer detection can be done very, very early on. In fact, this is an example of a patient who came to me recently who had pancreatic cancer, unfortunately not operable at that stage. We had series of CT scans done earlier. 3 years back, I had a CT scan, which we looked at and it looked normal. I sent it to some of the top radiologists in the world, and they all said it's normal because I was actually feeling guilty whether I missed a early pancreatic cancer. Everybody said the previous 3 years scan was normal, but when I actually fed it into AI told us that there is very early pancreatic cancer in this patient. There was something that the AI was detecting which human eye cannot detect. And that's the reason why I think for situations like this, especially in radiology, AI is going to be an extremely important tool. In fact, even in a hospital now, about 40% of regular radiology is read by AI. Only certain areas the specialist has to come in. So I think this is going to be, in the future, a very important area for AI to do. And look at other areas. This is artificial AI read beds where you can actually, the patient is put on the bed and the bed not only continuously monitors your respiratory rate, the pulse rate, the blood pressure and so on, but you can also continuously monitor your blood sugar, your sweat, so on. And you can actually link it to intravenous medications which are monitored by the bed. So you can, of course, have this completely nurse-free beds. The need for nurses come down using these artificial intelligent beds. And I believe that in future, many of our intensive care units, although currently they're costly, in future when the costs come down, many of intensive care units are going to have this artificial intelligence-led beds. And of course, coming to another area, clinical decision making. I'm a gastroenterologist, and when I do endoscopy, I see lesions like this, polyps which can be missed normally, but AI picks it up much faster. Mainly what AI is used for in fields like gastroenterology. Also, AI tells me whether this is a malignant polyp or a benign polyp. This can be used in similar areas in several areas also. We are also starting to use AI in operative settings. This is what we're doing. It's called a paroral myotomy, POEM. And when I'm doing this dissection, AI will tell me much before I actually see a vessel, about 90 seconds before, that there's a vessel there. So I can go and coagulate. In fact, tells me prophylactically coagulate. So even in surgery now, laparoscopic surgery, AI is being used to mark the organs, to show you blood vessels, to make surgery safety very, very safe. Navigation systems available where AI is incorporated into CT scans, MRIs. So as you're operating, you lay everything in front of you on a screen and then can use this surgical guide. But more impressive is this. This was a study published in Nature some time back, where 25 top dermatologists in United States were actually shown a lesion and asked what this lesion was. They gave different diagnoses like basal cell, carcinoma, squamous cell, melanoma, and so on. And when AI was asked, AI gave a diagnosis of amyloidosis of the skin. When biopsies were done of this lesion and sent to the pathologist, it came back as amyloidosis of the skin. So AI was right. Many of the experts were wrong. So this is one field like dermatology, like radiology, where AI to a large extent can replace doctors with a better vision. And this is, I think, something you should look forward to. Computer vision can play a huge role here in making definitive diagnosis. And of course, we can't get away from this. It's an era of mobile health. All these variables that are available to us right now, I'm having a watch, a ring, and so on. All these things now continuously give us a lot of data throughout the day. For example, right now, my EKG is being monitored, blood sugar by continuous glucose monitoring. We have strips now measuring cortisol, VO2 max, and of course, IL-6, IL-10, and gut microbiome. All these are integrated together. They go to a server in a hospital which continuously monitors my health and tells me, look, your VO max is now so much, this has to be changed, or your heart rate is so much going up, a continuous monitor. So if in future, what is going to happen is using all this data, physicians or even scientists in a central area can completely monitor the health of people everywhere, all over the place. So I think this is a very exciting area of what is going to happen in the future. One of the criticism of AI was that AI cannot replace human beings because of the empathy that human beings have. In fact, this is a strong argument against using AI in medicine. But look at this study which came in JAMA in 2023. Patients who had surgery went back home and they called back the hospital to tell the person in the hospital how he was feeling and he had any doubts. So when they called back, they were randomized. The calls were received either by a doctor, human doctor, or AI. And what was very interesting is the patients rated what was the reply. And patients said that artificial intelligence generated responses were better, they were more complete, they completely listened, and they were more empathetic, in fact. So you can actually make AI very empathetic so that not only is it giving you accuracy in diagnosis, but empathy value also becomes very high. And that's the reason why this becomes extremely important. So this is just a brief summary of where we're going to use AI for individual health, lifestyle changes, data interpretation, clinical decisions, complaints, and so on. But we're going to use it for prevention, diagnosis, treatment, and follow-up. All aspects of medicine are going to be used, and more for screening and surveillance. Large population screenings can be now done using AI, and models can be made using AI. And of course, in future, drug development and so on. So all these are going to be areas. This is just a broad view of where AI is going to be used. But many challenges that we have with AI currently. One is the quality of data must be pure. If the data is not good, then output is not good. You get a wrong result. So it should be emphasized to all doctors that in future, when they start using AI, the data they feed in should be absolutely of high quality. Second, the trust. If you're going to trust AI and do surgeries and so on, if something goes wrong, problem comes. So trust is important. Ethics important, very important to use AI in proper way. In fact, there are examples of how AI can actually giving it to non-ethical people can result in problems. The AI-related bed I showed you earlier, in fact, it said that it's been used by some spies in one country to kill other spies in intensive care using AI hacking the bed and giving wrong medication. So this is very important. I think expertise among doctors would be important. The other problem is regulatory strategy. Regulatory strategy is still not made. Even in advanced countries, we still don't have regulatory. If suppose something goes wrong when you use AI, is AI responsible or the doctor responsible? Right now, the doctors. But in future, we have to think about this regulatory strategy very carefully. Scalability is very important. Whatever we do in centers, each of our centers should be scaled so that everybody can use it. And of course, continuous evaluation system is very important. One of the criticism of AI is that if you continuously use AI for procedures, you de-skill the person. And this is an example in gastroenterology where colonoscopists used AI and they became experts. But after the AI was stopped, they got de-skilled and their expertise was lost. So you have to be very careful how AI is used, especially in skill-based areas. But other important area is, I think, privacy. Privacy has to be maintained. And cyber security becomes very important. If somebody hacks and gets the health issues of very important persons, this happened recently at the AIIMS where a lot of data was lost because of hacking. This single bit of data in dark market is available for about $200. So it's a huge amount of money. So people are constantly looking at important institutions to try and hack their data. So AI data can be hacked, and it's very important that we have cyber securities. There are now many available to protect this AI data. So again, this is a snapshot of the pros and cons of using AI in medicine. I think you can make better data-driven decisions. Treatment time is cut in half. All the information can be integrated. Unnecessary hospital visits can go. Patients can talk to the doctor on the phone, and you create a lot of time for administrative duties can be very efficiently made. The concerns are, of course, regarding privacy. I told you about data stealing that can occur, and of course, the high initial, it's extremely costly. Capital investment in these areas is costly, so each area has to decide how much they want to put in this. At present, there's lack of interoperability. The systems are not talking to each other. We have to see how that overcome. And of course, I think one of the problems is most doctors don't understand AI and they're reluctant to take it up, especially after a certain age. I think this and the fact that we have to assure doctors that unemployment is not going to increase because of AI. AI is going to just supplement this. So I think we can be very clear that economy in the world started with agriculture initially, went to military, trade, and now it's technology and AI driven. And I'm sure some 17th century where steam power was the main one to mass production, and now it's computing, and 21st century is going to be artificial intelligence. And that's the reason I'd like to acknowledge the Department of Artificial Intelligence at our unit, where most of the data which I showed you has been taken from. I think this becomes important. Get used to this. All of the hospitals start their own AI unit, and that's the reason why I'm extremely glad that the NBE-MS has started this project for doctors. I think this is going to be a revolutionary, very important series of lectures that are going to actually optimize our doctors into using AI in future. So also Government of India is extremely proactive in this. There's an India AI mission, a large amount of finance are devoted to helping AI in the field of medicine. Just to conclude, you see in 2009, the road traffic in the United States was controlled by a pilot who's to actually, and a cameraman who's to actually see what's happening in the road, give messages. 2019, drones came. And in 10 years, the cameraman and pilot both lost their jobs. That's the reason why it's become very important that we as doctors have to upgrade ourselves. If we don't upgrade, you're lost to a doctor who knows AI. And finally, I'd like to end by I think it's a very important slide what Charles Darwin said. It's not the strongest of the species that survives, not the most intelligent, the one the most responsive to change. We have to remember that we as doctors cannot be negligent to what is happening around the world around us. We have to take up AI, embrace AI, use it very efficiently, not only in our health services, both as an administrative tool, but also clinical tool. And I'm sure with this, we enhance the patient care overall. Thank you very much for your attention.
Thank you, sir, for this wonderful overview of what's happening in AI in healthcare. And in fact, I'm amused to see almost 1,000+ questions coming in the chat board. So you have many to answer on this. I would, after the presentation, we were supposed to have a short question and answer session. And I would like to ask Dr. Reddy with the first question. There are many questions here. I'm trying to filter most of them because it's almost more than 1,000. So the first question, when he talked about in his presentation about the foundation models. So in India, as we are growing in this AI field, do you feel foundation models which are pertinent to Indian context are more necessary, because we have all the foundation models what we have are from the Western world?
Yeah, I think, Rakesh, that's a very important question that was asked. I think we are dependent totally on now the Western foundation models that have been built over several years. And now as we're becoming more AI intelligent, we realize that our country has to build their own foundation models. And that's the reason why Government of India actually has given this huge grant and have asked the health industry, the health clinicians and all, to build their own foundation models. And this is what we are doing now. Ultimately, down the line, in next 5 or 6 years, we're going to have our own foundation models.
Yeah. So now this is the era of preventive and personalized medicine and precision medicine. So what do you envisage as artificial intelligence playing a main role in this? Probably in the next 10 years, I'm sure this is going to take a big leap.
Yeah, I think there's going to be a huge attention towards preventive medicine and predictive medicine. And this is the areas where I see, for example, we get this health checkups done. A health checkup, you get a huge number of data that's available. And some of this data is also genomics. You can now use AI to link all this genomic data, regular physical lab data, and together, and actually predict what is going to be the health pattern in this individual. We can also look at certain very specific areas like colon cancers and so on and predict. And with this prediction, concentrate on those areas of screening that this patient is likely to develop. Will this patient get a cardiovascular problem, stroke, colon cancer in next few years? These, using AI, we can actually which patient is likely to develop, concentrate on these areas and use it as a preventive medicine. And also we can do very specific prediction of even small pathways so that you can prevent what is going to happen. Suppose there's a 60-70% chance that this patient, based on the AI models, is going to develop stroke, even a neurological stroke. We can put this patient earlier on, very early on aspirin and prevent this from occurring. So I think these are very important areas. A lot of work is being done in this
So
area.
even the gut microbiome is a big.
Yeah, I think using AI and gut microbiome, you can do a lot of predictions. You can, for example, predict based upon the TMAO levels, whether a patient with a particular strain of gut microbiome is likely to develop a cardiovascular problem, and then alter the microbiome there so that they don't develop this problem.
Right. So this is one question from in the chat board. So you said about Mira. So the question is, what if Mira scares the patient when they ask something and then they say, okay, you'll have this, you'll have that, some side effects and all.
Yeah. So I think again, it's how we train the model that's very important. And Mira is based on a trained model. So it's trained in such a way that it does not give any wrong information, very factual information. And unlike human beings, these robotic models are absolutely accurate. So nothing extra is said. And also you can see that Mira is a nice looking model. So most patients tend to believe this rather than believe the doctor. So it's we've used this now for very, very long in our hospital. We never had this type of problem because very accurate information, which is literature evidence proved, only is given to the patients.
So there's another question, I think probably from a gastroenterologist for sure. So what's the role of AI in early gastric cancer prediction or early colon cancer?
Yeah. So this is a very specific question, but may not interest general audience, but huge data on this. So I won't go too detailed, but let me tell you that gastric cancer, early gastric cancer detection can be very difficult even for a very experienced endoscopist. But on the positive aspect, the only 3 changes that are there which can diagnose early gastric cancer in the gastric mucosa: a line of demarcation, an abnormal pit pattern, and abnormal vasculature. So it's been very easy now to construct AI models based on this. Several available, including EndoAngel and our model also. With these models, when our naked eye misses this on endoscopy, even magnification endoscopy, applying AI, we can almost 95% of the times catch these early gastric cancers without missing them. So I think this is a very powerful tool which we've already started using for gastric cancers, and I'm sure widespread use will occur all over now.
Right. So as you have mentioned in your presentation, so there's a question from one of in the chat board, the AI regulatory and policy, any specific policy which is there currently in India or anything which is going to come in the future?
I think Government of India is thinking strongly of what regulatory policies that has to be put in, but this is a very difficult area. Even internationally advanced countries like US, Europe don't have any regulatory policies because it's a very new field. The regulatory policies should include not only use, misuse, ethics of these things. Several things have to be taken into consideration. If the regulatory policies are very strict, then AI won't develop. If they're too liberal, then of course, AI can be used for wrong reasons like the fake AI that we have now. So one has to balance it very carefully. But in 2 or 3 years, I think most of the countries will come up with regulatory balances that should occur in this area.
So continuing on the same note, this is a very interesting question by probably a surgeon. So he says, if I have AI assisted tool and I perform the surgery, something goes wrong, will the surgeon be blamed or surgeon will be out of the blame?
No, right now, according to legal issues involved, it's a surgeon to be blamed. Even if you're using AI and some mistake occurs because of AI, it's the primary surgeon and the hospital which will be blamed and not the AI itself. You cannot sue AI now.
So another question is, I think probably you are there, that's where they asked you about AI and antibiotic resistance.
Yeah, I think this is again very important. In fact, in a lot of our microbial research, especially in antibiotic AMR, AI can be used very effectively to predict the resistant pattern that are going to occur. So you take community samples all over, you get cultures and all that, what is the pattern of resistance that occurring and what is likely to occur. Because these microbes have a fantastic capacity to exchange the resistance gene. So they can have predictive models actually to predict this, so that, and also not only prevent this, but also we know that which different types of antibiotics we can turn to, so the chance of resistance come down. So this is a whole new field, a lot of work going on in this area.
Yeah. So now you run a big department of Center for Artificial Intelligence Innovation. The main problems as from the management perspective or then doing it in a hospital setting, the ethical challenges in implementing healthcare, where the patient data is something which many of them ask that I have to have my privacy. So how do you look into that, and what is the suggestion what you have?
I think privacy of patient data is extremely important in this situation, because if somebody hacked into your system, the patient's data goes out. So as we're getting into this era, it becomes very important, and therefore we have to pay a lot of attention for cyber security. In our own hospital, to protect the data, we use huge amount of cyber security, and now cyber security is becoming more and more sophisticated as cyber thieves are also getting sophisticated. But we have very sophisticated cyber security, so it's almost impossible to hack the system and take data from this system. So I think that we are safe.
So, and from the doctor's perspective, we have hundreds of doctors in your institute. So adaption and adoption of AI by doctors.
Yeah.
How do you see that?
So this is a challenge. In fact, very peculiarly, when we started applying AI in a hospital in a widespread manner, we found surprisingly that it was the nursing staff, the non-medical staff, who took it up first very easily. And then, of course, the younger generation, because they're already used to it, we find it very difficult above the age of 50 years to convince people to take up AI because so the older generation, I think, takes it up much less. But once they see the utility, they're also taking it up. So there is a generational difference between who takes up AI and not. But in general, I think all of us should be tuned to this.
Yeah. So just to wrap up, what is your message to this audience? Because they're going to have multiple series of educative events in the next coming weeks. So do you suggest anything to read for them to just get into this, to sink into this subsequent lectures?
There are many books, there are many lectures, audios, and all available. But in general, I think that it's very difficult to, as medical profession, to read what is available as AI. I would suggest that pay very careful attention to all these lectures that are going to come subsequently. We just gave you a broad overview of where AI can be used. And now individual lectures is going to give you an individual specific area. So I'm sure once you follow the series of lectures that NBEMS is conducting, you will be AI savvy and should be able to at least have enough knowledge to use it very comfortably.
Right. So I think we would end it here. We have many more questions, but because of time constraints, we will end the discussion here. And if you have any questions online, then we will take it offline, or we can have some individual discussion somewhere in the other forum. So we thank NBE for giving us this opportunity, and we wish all the best for the subsequent lecture series. And we wish all the delegates who have registered into this to gain knowledge and become AI experts by the end of this series curriculum. Thank you.
Thank you, Rakesh. Again, thank you, NB, for giving us the opportunity. I think this is a very exciting series of lectures that are going to come up, and I'm sure the community as such will be definitely benefited.
Thank you very much, Dr. Nageshwar, sir, for an excellent thing, and thank you, Dr. Rakesh, in such a nice way. And as rightly told by Dr. Rakesh, we are going to take any further questions offline. And I hope it's okay to share the speaker's mail IDs with all the participants.
Yes, sure.
We can communicate with you, right, sir?
Yeah.
Suresh here, joining from NBEMS office, Delhi. And we have our team, Dr. Rakesh, and other people who are there with us. And probably we are just now going ahead with the inaugural thing, which will be displayed in the next few minutes. Bear with us, sir. Thank you very much.
Okay. Thank you. Thank you.
There are some requests that I'm seeing in the chat box, requesting for the technical expert to speak. I humbly request all the participants to go through the curriculum which was shared yesterday. There are 20 lectures which were there, and next onwards, people from IISc Bangalore and other things who are core AA experts who are going to teach you on the very basics of them, which is applicable for the medicine. We have thoughtfully curated the program with the help of all the experts in such a way that technical expert and medical expert, both of them are there who are going to moderate the thing. And there are a lot of questions that are coming for the feedback form. Feedback form will not be shared in the YouTube. I humbly request the people to go back to their login account, whatever was shared in the beginning when they got registered. There you are going to get the feedback. There will be 5 pertinent questions with respect to this particular specific topic, just to help us understand how the speakers can improve in the next lecture sort of thing. It is not an assessment. I repeat, these questions are not counted for assessment of the curriculum. The actual assessment is going to happen at the end of all the 20 sessions. And you have all the time next 2 hours. And as rightly told by Dr. Nageshwar Reddy, you can always take the help of AI to answer it. We don't mind as long as the feedback form is concerned. But if it comes to the real one, we are supposed to do it honestly at the end of all the 20 lectures. We are going to deliver on those things. There are few more questions that came in the chat box regarding the medical legal aspects. Module 18 is going to cover the medical legal aspects, and 17 is going to cover the ethical aspect of those things. And probably I request Dr. Nageshwar Reddy's team to answer a simple question that, sir, Mira, is it available outside for outside people is a question. I don't have an answer. Probably there is one question that is getting repeatedly popped up when I just try to churn these things.
Yeah. So, Suresh, Mira is currently being evaluated at AAG. We're using it extensively. Right now, it's not available either outside or commercially, but once we want to make at least 200,000 evaluations before we put it out so that it's very accurate.
Thank you very much, sir. That's the answer from the horse's mouth. So Dr. Nageshwar is telling that they are evaluating, they are perfecting it, and soon probably sir is going to announce in a next few months we can expect it, right, sir? That Mira is going to be that true assistant sort of thing.
Yes,
Thank
yes.
you very much, sir. Thank you. And there are a few more questions that popped up regarding how can we use specific to our department. I've seen questions being asked for obstetric anesthesia, ENT. It's very encouraging to see such questions. After this first sessions of 20 lectures, we are going to have a department specific AA modules of 10 hours each, which will be given only to those departments. That is, medicine will be teaching medicine, gastro will be teaching gastro, ops will be teaching ops. So that curriculum is getting curated, and we are going to run specific feedback form very soon. And based upon the feedback form, we try to understand what the practicing physicians or students want to listen, and we are going to curate. And we have eminent experts available with us, which are going to do that. One more question that came, sir. Anything that AAG is doing in specific for training in the gastro of the AA gastro?
So AA Suresh, AA gastro, it's continuously going on here. We have short programs. We have monthly, we have some courses where people can come and learn. But I think more important than that, because gastro is actually computer vision related, where actually developing a lot of programs to detect polyps, cancer, benign, and so on. More important would be a general AI, I think people should know, where we actually conduct this course along with the Indian School of Business, ISB. These courses occur twice a year now. We're going to make it 3 times a year, where a full-fledged course is we curated this along with ISB. And when you do these courses a few days, you get to have a real grip of what is happening in AI. So you can look out for these notices. Those who are interested can join this. These are not online courses. These are physical courses. So you have to be there, because the tutors will then give you questions to answer. Workshops are there. So it's a very comprehensive course.
Great, sir. Thank you very much. And few people have asked, can we get the recordings available in YouTube? The answer is perfectly yes. Anyone can see this great lecture on the YouTube. It is available. Now we sincerely thank all the participants, and it is the time for the actual inauguration of these things, which you are going to see in next few seconds. Thank you very much.
Good afternoon, everyone. Secretary Health, Punya Salila ji, Additional Secretary Vinod Kotwal ji, President NBEMS, Professor Abhijat Sheth ji, Vice President, members of the governing body, and all the eminent guests and participants who joined us physically and virtually today on this very, very special and momentous occasion as the National Board of Examination in Medical Sciences has decided to launch this online training program on AI in healthcare for doctors across the country. And I'm very happy to learn that more than 42,000 doctors have already enrolled. And as much as I understand, more than 50,000 doctors were your target. So it's quite, it's a good news that so many doctors are showing so much of interest and they are willing to participate in this 6 months long course, which covers 20 different lectures on the effective use of AI. And we all understand that today we don't really need to discuss the whether AI has a use in healthcare, because worldwide it is making a difference. It is being used widely. So considering that it's a very timely and a forward-looking initiative, I welcome my DGHS as well, Dr. Sunita Sharma ji, and other guests who have joined. So today it's time to discuss how we have to use AI in healthcare and how responsibly and ethically we can use it. We all understand that using AI is no longer an option. In fact, it is a necessity, because ours especially is a country where we face a shortage of doctors and we have challenges. We are still grappling with non-communicable diseases. We are grappling with the burden of TB. And recently, when we had undertaken our intensified TB prevention elimination campaign, that time we made use of AI supported devices also, and which made a huge impact in our screening and diagnosis. So we understand the potential of AI in complementing the efforts of the doctors. AI does not compete with the clinicians. It actually compensates for their absence. And it's a very useful, these tools and technologies are very useful in improving diagnosis, in enhancing the patient care outcomes, in advancing medical research, and in overall supporting the clinical decision making. Because like I said earlier, we face the shortage of doctors and the burden of patients is rising every day. So in such a scenario, there are situations when doctors have to interpret and analyze huge amount of information, and in limited time. So AI helps us to make that analysis in a very short period of time, quickly, accurately. So that way it complements, it supports, and it should be widely used. So I would like to compliment NBEMS for coming up with this very structured academic program, because it's important that these tools and technologies are not just used in healthcare, but they are used with a sense of responsibility, professional accountability, and with ethics. So these kind of structured academic programs can be very helpful in sensitizing our doctors and familiarizing them with the applications, with the fundamentals, with the basics, and with the limitations of these AI tools. So I once again compliment NBEMS, and I also learned that you have applied for the Guinness World Records. So, well, we appreciate that.
Attempting नहीं चलेगा.
I think 42,000 doctors joining them, so they're quite overwhelmed by the response that you're getting.
पुराना record क्या था डॉक्टर से?
1,400 in Brazil.
Okay.
That's good. So I guess the entire effort of everyone should be to encourage more and more hospitals and more doctors. And I would also appeal to more and more doctors to apply for this course, register on the portal. It's just 20 sessions and it'll equip you in ways where you can responsibly and very meaningfully make use of these AI tools and technologies. So with this, I thank you all for this initiative and I extend my good wishes for the success of this very, very beautiful academic endeavor. Thank you very much.
Thank you very much, Aditya. And with this, we conclude today's session. And next session is going to be on next Wednesday between 4 to 5 p.m. Procedure remains the same. And if anyone who want to understand the complete curriculum, it is available on the portal. The dates are designed in such a way to avoid public holidays. And 4 to 5 p.m. was chosen because that is the best time that we came to learn from the feedback forms. And I thanks once again the speakers, the moderator, and all the enthusiastic participants for being a part of it and making it successful. Just to tell you that the views today are 29,000 with a 15,000 participants viewing at any given point of time. That's a great success. Thank you, everyone, one and all. We congratulate ourselves and Dr. Nagesh Reddy sir. Thank you very much for initiating this great event. Have a good day. Bye.
Thank you. $15 anytime. Any money.